appreciate your time and being able to share this with you. So, Dementia Friends Indiana, this is a very exciting program. It's been a very successful program in just a very short amount of time, and we can talk a little bit more about that. But as we're looking at here, we know it's successful, but are there more opportunities to measure actual impact in various ways of how this program is moving the needle within communities across Indiana when it comes to dementia? So to get started, I'm sure a lot of people in this room are already relatively familiar with the state of dementia, but this is why this program exists. We are at an epidemic status when it comes to dementia, not only in Indiana and the United States, but across the world. Even though it's epidemic today, the numbers are supposed to triple in the next coming decade. So even with the challenges that we're facing now, it's only going to get more and more challenging going forward. And you can see, as evidenced by that, in some of the statistics. It's also been recognized as now the most feared disease in our country. It surpassed cancer a few years ago. And that fear is by all age groups, not just older adults. One of the things that we highlight too, I think it was on the other slide, is the caregiver too. So I always describe dementia as a two-person disease. You have one person who has the actual pathology of the condition, and then they're usually going to have at least one other primary caregiver, whether that be a spouse or a child or somebody. And I think it's in a different slide, but that's an epidemic in and of itself too, is the caregiver role when it comes to this condition. And so when we look at these statistics, we have no cure in sight. We're still a ways away from a disease-modifying agent to slow the condition down or to stop it, but yet it's continuing to grow. It's hitting our communities more and more. It's very challenging. It's also very misunderstood. There's a lot of stigma behind it and a huge knowledge gap. So what do we do about this in our communities? Because it's coming. It's not, we can't stop it. It's coming, and we're seeing it already. And so we think the solution to this, and we found a lot of success with Dementia Friends Indiana being the solution in the state of Indiana for this, and we want to build on that going forward. And so here's what's going on in Indiana alone. And of course, these numbers are only going to continue to rise year after year. So again, we think that this is essentially the solution. And so what Dementia Friends Indiana is actually pretty simple in nature. And what we want to do is better educate individuals as a whole, communities at large, about what dementia actually is. There's a huge knowledge gap about the condition that has led to the stigma. And so our first priority is to narrow that knowledge gap and get people to really understand exactly what this condition is, what the different types of dementia are, and what this means for our communities. And then the other part of that is then to take action to do something about it in our community. So you become a dementia friend, you understand the basics of the condition, understand the perspective of those who are living with it, but it doesn't stop there, it actually begins there. Then you're tasked to go do something about it, to move the needle in our communities, to make our communities more dementia friendly and more welcoming and conducive for those living with the condition. And I'll say too, this is a global movement. It's been around for quite a while, actually, all in countries all across the world. Just recently to the United States, though, however, so it's still relatively new here, even though it's been around a couple of decades, and it's housed out of the United Kingdom. Indiana became the 10th state in the nation to adopt this program. As of now, and that was back in 2017, as of now, between those who are dementia friend states and those who are in the planning process, there's close to 40, and there's a plan for all 50 states eventually to be a dementia friend state. So as I mentioned, really it comes down to the core of this program. It comes down to two things: education and understanding about the condition, and then taking action to do something about it, to make our communities more aware and more welcoming and conducive for those living with the condition. So at the core of the education are what we call these info sessions. And that's actually how people become a registered dementia friend. You attend this info session. It speaks to the basics of the condition, the different types of dementia, how to communicate, how to approach. We like it too because it's very interactive. And so you get a really strong perspective and appreciation for what somebody with dementia is going through and how they perceive the world. And that's what we really like about it, because the light bulbs really go off, even to people who are experts in dementia or maybe who have been bedside clinicians with dementia. They learn things or new perspectives from this that they never thought of before that they can apply in the real world. So when you walk away from a Dementia Friends info session, you immediately have whoever you are, the average citizen immediately has the information and tools that they need to have a better interaction with somebody with dementia, have a better approach, why they need to be more patient with somebody, et cetera, et cetera. And so it's also a very positive message. So part of this is, part of the education and the stigma reduction is that, yeah, you may have dementia, but so what? You have a cognitive condition, you can still participate in society, you can still enjoy life. And through this, we want to try to disrupt the isolation and withdrawal that's associated with the condition, which is also one of the more detrimental components of the condition. So I mentioned this is also about the caregiver as much as anybody. And so you can kind of see some alarming statistics here, to the extent now that caregivers, specifically of spouses with dementia, are passing away. They have a higher mortality rate than the ones that they're caring for. And that's been associated with evidence that that's stress. And so they have lower immune system responses, higher cancer levels, higher cortisol levels, and other things specifically associated with dementia caregiving. And this isn't just an older person's condition anymore either, as reflected by 1 in 6 millennials at the average age of 28 being a caregiver. And they're reporting the same financial, emotional, and physical hardships from that role as anybody else is. And so when we look at this stuff, we're not just talking caregiving in general, but dementia caregiving is just on a whole new level when it comes to the stress and burden that's associated with this condition. And as I mentioned before, isolation and withdrawal then becomes one of the biggest consequences of this condition, both for the person with the disease and their caregiver. And again, that's what Dementia Friends Indiana we're trying to disrupt is to reduce that isolation withdrawal so people can remain independent in their communities a lot longer, because our communities are more welcoming, understanding the condition, and have made it more conducive for those living with it. So some quick highlights where we're at now. So 4,200 Dementia Friends as of November, or actually at the end of October. That's not bad for only being 2 years old. That's about 8% of the United States total. Just in Indiana, in just a couple of years that we've done a lot of really innovative things that the rest of the country is looking at. So we're not flying under the radar anymore. We're actually on the radar, which is scary, but some of these partnerships, and these are just some of them, but this is the kind of level that we're talking about when it comes to the impact that this condition is having. So Indiana Department of Homeland Security just came on board. All first responders in the state of Indiana, EMS, fire, and police will become Dementia Friends and educated on dementia through this partnership. A lot of hospitals, including Eskenazi here locally, are very interested in the DFI movement. One particular hospital, IU Health Saxony in Fishers, is going to be the first Dementia Friends Indiana hospital that's hospital-wide a dementia friend. And so that's going to entail every single employee, from physicians down to anybody in that hospital that you encounter, is going to be a dementia friend, which means that when you walk into that building and you have somebody with dementia, if you're a caregiver, you know that no matter who you encounter, they're going to at least understand the basics of this condition, understand your perspective, what you're going through, and be welcoming to you. And so part of that too, we're going to have a little research project with IU Health Saxony that I'll talk to you a little bit more about. But FFSA, Division of Aging, this program actually led to a catalyst that's been for a dementia care advisory group that's been started and led by the state of Indiana. So we're planning on, what do we do about this condition within the state going forward? What we are missing, I mentioned we've had a lot of this success, but there's not a lot of measurement to actual impact of this. And what I think is a unique opportunity here is this is true across the entire country. So I can attest the entire country when it comes to this in Dementia Friends USA, the topic is always research and measuring impact, but nobody's doing it. And so I think we have a really strong opportunity here to explore opportunities on a national level to be recognized for measuring the impact of this movement and what we're doing here in Indiana. I mentioned IU Health Saxony. So one study that we're doing, IRB approved, is we're going to measure the clinical on the 3rd floor inpatient unit at Saxony. Through this program, through the education, does the clinical staff feel more empowered, feel more confident, more understanding when treating people with dementia? Do they have a better approach to it? Can they reduce behaviors, et cetera, so that we can actually measure that through this simple but very impactful movement and program, that it can actually improve clinical outcomes for people with dementia in hospital settings, while also making the just the jobs a lot easier for clinical staff too. So that is in the works as of right now, and we should have those outcomes by this summer. So when we talk about action, these are just some examples of some of the actions that people can take. So they can be really small, to just simply getting people aware of what this program is, to get more people talking about it and connected to it, all the way up to those higher level examples that I just provided with stuff like high level government, hospitals, and Homeland Security. But the purpose being that these actions gradually make our communities more understanding and welcoming, so that our businesses, our churches, you name it, are better prepared for this increasing amount of folks who will be living in our communities with this condition. So at the conclusion, the aim, advance education and awareness of the condition, and that's the biggest thing right now, is just getting people to talk about it and reducing that knowledge gap. I haven't seen a condition that's so prevalent, affects so many people, but it's still so misunderstood. So we're trying to combat that. And then create community environments that are more welcoming and conducive for those living with dementia to experience and navigate. And actually, to go along with that, a new study just came out, dementia as a whole, that just showed that 83% of people with the cognitive condition have changed their shopping habits to shop at places that are more accessible for them. So this does have an economic impact. And through this movement, these are some opportunities, I think, where we can get businesses on board. You name it, really, it affects every community sector, to get on board to make these accommodations for people, because there's actually a bottom line to it, to them too, and there's billions and billions of dollars lost to dementia caregiving every year in the United States. So I think I'll turn it over to Dan Bateman. That's our ask to you. How do it's successful, it's big, it's fun. And but how do we measure the true impact of it? And if we can, it could be the first time in the nation.
Thanks, Dustin. So I think, when I sat down and talked with Dustin, I sit on the medical advisory board for SACOA, which is the local area agency on aging. And he told me about this program. I saw just so many different light bulbs were going off in my head about what are the things that we could do and how could Regenstrief be more involved. So I think, one of the things Dustin and I talked about is there is not much actual research or publications on Dementia Friends or the intervention. And in terms of how they're evaluating the program right now is kind of Likert scale based information around awareness, confidence, and feeling equipped to help people with dementia, and then feeling inspired to offer support or to adopt dementia-friendly practices. So I think, one of the things we're trying to wrap our minds around, or at least I am as a scientist, is where to start, I guess, because there's so many different domains. It's such a huge goal and rollout for Dementia Friends Indiana. So there's hospital-based systems, healthcare systems, businesses, townships, cities, and counties. And one that sticks out to me is the emergency services in Indiana, and how Indiana can be potentially a national leader in this area. Just from my reviewing of what little literature I could find, there are some publications put out by the U.S. Department of Justice, but not a lot of kind of evidence-based interventions for education for police, firefighters, and paramedics. So there's almost too many options. So I think one of the things that I think a starting place is trying to engage EMS and maybe trying to, because I think one of the things is Dustin and his team have gotten a ton of positive feedback, but how do you, that's not, how do we actually prove that the intervention is successful, or that the intervention is meeting the needs of the people we're trying to educate? We've thought of potentially doing some first initial qualitative approaches, reaching out to fire departments and police departments, and kind of just starting off with more formal needs assessment. And we've also thought of, quantitative evaluation that we roll out with the project, and have kind of an iterative format to it. The other question is, what are the outcomes? It's not always as easy if you're talking about EMS, about looking at, it's not the same thing as what we think of oftentimes for hospital outcomes. They focus a lot on, how many calls, time to a call completion, in addition to other health outcomes. So I guess we just wanted to open it to the floor and see what people had for thoughts, because this is like, this giant brain trust we have at Regenstrief. Yeah.
Well, first of all, thank you for coming and working with us. I think it is very exciting and a great opportunity. I think it's also, to your point, how working across Regenstrief could be very helpful. As it happens, for a different project that we're doing around the Addictions Grand Challenge at IU, we have the task of pulling together a data commons that actually pulls data from a variety of sources. And one of the activities that we've already engaged in to address that issue, but I think it maybe could be repurposed to help with this one, is actually connecting the EMS run data from Homeland Security with the health data we have in terms of emergency department visits and then beyond. Nobody has ever integrated those data sets and actually matched the individuals across. We now have the capability of doing that through an arrangement that we have with the state's management performance hub around that initiative. And I would have to imagine it would be a welcome idea to think about how we could take that connected data set and be able to do some analyses around this question. So I just wanted to make sure you were aware of that, because again, it's one of these things that's happening, but not necessarily are we all aware. So this is a great opportunity to think about how we might take that resource and that capability and now think about applying it to other use cases like this one.
Yeah, that sounds like it has potential to be quite amazing. Dr. Schleier.
Good work, Dan. So two things. One, a suggestion. Couldn't Regenstrief be a dementia-friend place, like Saxton?
Yes, yes.
I mean, it would make sense. The second one.
We should lead the way. Yep.
I would like for you to explain a little bit more about your outcomes, because I think when you think about an evaluation strategy, yes, you can do process and structure, but what we really care about is outcomes. So what intuitively do you or Justin kind of think about? So, let's say Dementia Friends is, broader and broader. What are the tangible benefits for either the person living with dementia or the caregiver that you guys expect, reasoning from first principles?
Yeah, I think I'll start off, and Dustin, if you want to jump in. I think what comes to mind is, some of the low-hanging fruit is, but not exciting, is kind of, I don't think as exciting is kind of, confidence levels and getting that kind of information about how confident people are at treating. I mean, like to see more hard outcomes, and I'm not exactly sure what that looks like. It could be some kind of, some kind of manifestation of agitation, or kind of number of episodes. If we could find out the denominator of number of episodes of people with dementia who have, or cognitive impairment, who have contact with EMS, what their experience is, or, I guess the answer is I'm still not sure, because I don't also know what we have available variable-wise. Dustin, do you want to chime in?
Yeah, I mean, I think it's so wide open. I think that's one of the challenges to it. What we could do. I mean, why anybody gets up out of bed in the morning to do this is basically to better educate our communities so that on both ends, our communities are more equipped to engage with people with dementia, feel more confident about it. Those inherent challenges that otherwise might exist are eliminated just by having the basic understanding of dementia and communication. And then on the other side of that, obviously, that the more people with dementia and their caregivers feel welcomed to remain in their communities, to go to the grocery store, to go to their church, et cetera, the better they're going to be. So, we even some of the components of measuring within businesses their level of understanding about dementia, and then going through this intervention, and then measuring some type of outcome around them being more equipped to take in people with dementia and make their environments more readily accessible. Components like, we even have a dementia choir now. So that's a choir with people with the condition and their caregiver, which is a reflection of the movement that, I have dementia, but I can still be out in the community and having fun and enjoying myself. And so can we measure satisfaction components with that as a caregiver, I was depressed, I was stressed because I was isolated, withdrawing. Now I'm back in the community. I'm engaging in this with my peers. Did my stress go from a 5 or, from an 8 to a 5 because of this activity, et cetera? So it's really wide open.
But the caregiver perspective is an interesting approach too of their contact. Dr. Hickman.
Thank you so much, Dustin and Dan. I think the outcomes in part are going to differ depending on which subset of the population you're talking about. And clearly a business having their employees trained in this program are going to have very different goals, and the outcomes that matter to them are going to be very different than for emergency medical services. And I think it would be worth identifying which group you're most interested in. You've already identified EMS as a potential target, and go out and ask them, do some focus groups, talk with them about why they think this is a helpful training. Is there any component that's missing? It may lead into intervention development as well. There may be an opportunity to add something specific to that population. If I'm trying to imagine what kinds of EMS outcomes might be of value, but some of it may be around management of physical aggression, which I'm not sure how much is in the Dementia Friends training, but that would be an area potentially where some additional education might affect outcomes that are really important to them. Like how often they're thinking about in the nursing home, it's a huge issue. How often do their EMTs and paramedics get hit, for example. So I think talking directly with those end users, because I think the motivations for in completing and being part of a statewide initiative like this probably vary differently, and people are trying to get different things out of it. But it seems like starting with those kind of basic questions and focus groups with your identified interest area would be a really critical first step. I do think it could lead into lots of opportunities for evaluation within those settings and potentially intervention development.
Great. Thank you, Susan. Any other questions or suggestions from the audience? This has been helpful feedback so far. Okay, well, thank you very much.